Great. Ashley, thank you very much. And thank you, Diane. I'm really glad you're recording this. We had a lot of people inquire on our site with the conflict and the time, so it's perfect. And thank you for the invitation today. Let me go ahead and just get on with the slides so that you can see what's going on and we can dig right in. All right, Ashley, thumbs up. Can you see the slide deck? Cool. All right, thank you, Diane, too, for this invitation. I am Lorelei Walker, Dr. Lorelei Walker, and I also work for the Washington State Department of Health. Now, I founded the nonprofit back in July, and I'm currently on the board of directors. So I'm speaking to you today wearing my vice president for the board of directors hat for the Social Safety Initiative. We're a proud member of the Linwood Chamber of Commerce. We're located right up here in Linwood, and you can go to the About page on our website to watch a video and see how SSI developed and our accomplishments and how we were really here at ground zero with the King County government employees, the clinic workers, the bus drivers, and those essential employees that were on the ground doing this work before the CDC was even doing mask wearing regulations. So as a child, my sister and I grew up in our parents' dance studio. They were owners and operators of a couple of dance studios in Pennsylvania. And I saw firsthand the grit it takes to keep a small business going, even in the best of times. And these certainly aren't the best of times. So I appreciate what everyone's doing to try and weather this storm, to keep our community and our economic health viable to make it through this so that we're there on the other side. So who is SSI? We're a nonprofit that promotes social awareness. So public and safety protocols during a pandemic, an epidemic, or other extraordinary circumstances. And we specifically provide small businesses with clear and practical training materials. We've gotten it broken down into what to know, what to do, and how to do it. You may have questions as we go through this presentation. Hopefully we'll get the bulk of them answered as far as what SSI is doing, but you can put them in the chat tool, and hopefully we'll have some time at the end of this to do a Q&A. We're also going to put a link in the chat tool for our wait list. The entire package you'll see today should be rolled out towards the end of the weekend into Monday. So it's limited spacing because we're ramping up with the full package and full support. So you can get on that wait list and be first in line, as it were. We just opened the wait list. So we believe in public health, and the science proves that through simple behavior training, worksite risk assessment instruction, and disease transmission education, those three things, businesses will be equipped to make effective decisions as they plan and on the spot for how to best protect their people. Now that's your customers, your clients, your staff, but also your community, because you make an investment in your community every day by being there. And they want to make an investment in you back. They just need a roadmap. And we believe businesses need one too. When we first started SSI, we launched a listening campaign, and we really wanted to be intentional about what the exact problem was, what the barriers were to coming to a solution. But that solution has to be realistic and it has to be doable. So we found consistently across business, but also across communities, churches, the whole spectrum of our social institutions, that there was conflicting in guidance right from the beginning, a lack of local public health support for communities and especially businesses. And as the financial support rolls out, it's still, well, what are we going to do at our site? And then this lack of national awareness on how to prepare and navigate society when we have this unknown viral transmission going around. And so the barriers become this dearth of risk reduction skills, whether it's how I navigate with people that come into my house, or how I open a business and have clients operating. That lack of social hygiene instruction, even how to wear a mask appropriately, and then this non-filtered information overload. I myself early on, if you're like me, you found yourself like I did being overwhelmed. I had a stack of research material coming out each week, news articles that went on, recommendations from different states, from different parts of the world, and then seeing how these practices were playing out in real time. And then you have a new strain coming around. And what does that mean? And so, what I found myself asking when I started the Social Safety Initiative is, one, who do we need to get at the table? And we developed a roundtable of 7 experts. What do we need to tell people? What does my family need to know for their businesses, their churches, their community institutes, and their personal safety? And what does my daughter need to know? Because we've got to fly to Florida and back in May and June, right when that second peak was happening. So that was the solution we came up with. Disease transmission education, enough science so that you know what to know. The worksite hot zone training, so that when you look around your worksite, you can do a systematic risk assessment for where the hot zones for transmission are. And then 8 safety protocols, 8 public health, science-backed, well-worn public health protocols. They can't be any 8 though, and they can't be at any time. They have to be the right 8 at the right time in the right place with the right training. And that is easy to do. My 6-year-old's been doing it within our family since March. It just has to be something that's laid out and in front of us. So when we think about being in the community, we have a couple of layered issues that we need to deal with. One, we've got to keep our site open. And to keep our site open, we have to keep it safe. We have to make sure the viral load's down. So we need to know when to clean, how to clean, where to move people. We need to know how people should interact, what our staff should do, and how our staff needs to know to keep themselves safe. Because everyone has different interactions and different setups, but the same protocols can be applied anywhere as long as it's indoors. 2, we have to have the ability to watch the disease storms. So when I was a little kid, we lived in Pennsylvania and we would get snowstorms and they were commonplace. Everyone had chains on their cars. They salted the roads. You could still get to dance class, but it was rural Pennsylvania. And as soon as that snow turned to ice, my mom and dad needed to know to shut the studio down, to call everyone, close it off and say, hey, it's not safe to travel right now. Go ahead and we'll come back tomorrow. We'll get together. Maybe we'll open up another day or we'll just work twice as hard next time. So stay safe. And there are tools that we can teach you where you can use them in a real easy way just to watch in your community. Are your numbers ticking up? What's that magic number you need to be under? 50 per 100,000, because 50 per 100,000 means that public health can do the tracing and that the systems don't become overwhelmed like we're seeing out in California and we saw in New York. It's containable, it's manageable. And if it's not, then you can make an on-the-spot decision to say, staff, stay home and close down your site proactively so that you can reopen the next day. And then we need our community to be safe. Those are the people that are coming in and out of your site. And if they're educated and trained in a forum that is something they can digest and use, then the community becomes safe and the bubble of disease goes overhead and away. And then not only can you reopen safely, but you can stay open. The government, the state, your local regulations are going to see where that disease number is in transmission, and they're going to feel comfortable saying, okay, everyone's trained, we're doing it the right way. Let's get back to business and get back to economic and physical health. So I'm going to lay out for a minute exactly how 1, 2, and 3 work. But it's through that what to know, what to do, and how to do it that we can get all 3 layers addressed, and we can do it fast. So how do you get this? Well, we landed on a 6-month support package, and we front loaded it with a e-manual that this beast, it's like 40 detailed pages, but it's relatable, it's fun, there's graphics. If you've seen our Covella versus the video or versus the world video on our website, you'll see that we've got humor. This isn't just dry. We teach you about breath clouds. If you walked into a fart cloud in Walmart or a store, you'd step to the side in a heartbeat and wave that away. Well, that's what these are. They're breath clouds. And so when you walk forward in line and you step on that dot, step to the left 2 feet or to the right and kind of zigzag, because you don't want to step into that breath cloud, whatever may be in it, because it's not just viruses. There's a lot of stuff we've been dealing with for a long time. So think about the fart cloud, and that's a way we can also teach our staff and we can teach our community. But this manual is going to be your first go-to. It's going to show you disease transmission. It's going to give you the chart for risk assessment in hot zones. It's going to lay out the 8 safety protocols. And it's people in public health that developed this and worked through it and created it. The graphics are fun. Now, when you have that under your belt, then you come into an orientation, and that orientation is a live orientation. We're going to work through, okay, what does a site operator need to know for a risk assessment? And what do you need to do to train your staff? And then you can lay out your protocols. You can lay out your cleaning schedules. You can lay out what you need to do on the spot, because you're not boxed in to a prescribed system. It's flexible, it's usable, it's knowledge and power. And then we'll do weekly, ongoing talk with the experts. So we have partners in the ventilation industry, because you got to get that air moving. Those breath clouds are still going to be a thing. Proper fitting masks, they're your best friend, because they're going to reduce that risk right off the bat. But you still have people eating and talking and pulling down their mask and say, no, that's not the one I want, the one on the left, until we get the community on the same page and we're role modeling for them. We're going to need to get that air up and out. So we'll have ventilation experts, and they can tell you, look, maybe you can't get up to a MERV 13. What's a MERV 13? What does that filter do? But you can do some things right now. And which windows do you open to get a cross breeze? Does the air come down on everyone's face, or does it go up and away? And so we'll have that, an ongoing Q&A forum. We'll have a resource bank. This will go on for 6 months, where we can change and update on the spot. So what does it mean with the new strain? You don't get sicker, yay. You're not more likely to die, yay. But if you're in the 20%, you're more likely to get it, because it goes back and forth across people a lot faster. So that means we're still going to see rates go up, and we're still going to get the burden that we have in our communities and move towards shutdown instead of reopen. We also need the gear. The gear is critical. In March, I was representing 7,000 King County government employees. I'm a public health professional, but I was also focused on staff safety and health during the pandemic. This is the clinics, the bus drivers, the medical examiner's office, the whole range of people that weren't at home during the quarantine. This was before masks with the CDC were a thing, and hand wash and social distance, yes, but how do you do that if you're a bus driver? What is the reality of what you need to deliver in your business or for your work? So we partnered with ASTI, and in March, we got together. We had a seasoned engineer, a molecular biologist, a public health expert, 2 textile experts, and came together and said, okay, what do we need to be safe? Worker grade gear. What do we have on hand? Yeah, there's surgical masks, and you're probably seeing a lot of people wearing them wrong. If they've got those venting out the sides, they're breathing that breath cloud in and out when they walk forward 6 feet. So we need something that fits, and it fits all faces, wide, flat, European nose out, glasses. I wear glasses. We have, ASTI has glasses or masks that actually fit with glasses. So we partnered with ASTI, and they flipped their business overnight. They started creating worker grade gear that has a polyester spandex weave. And this is important because it's a antimicrobial property in the fabric, and that reduces drastically the amount of risk coming in that air. It also reduces the amount going out. It contains the cloud, but it has to be soft. My kid has to wear that mask every day. I chuck her out to daycare because I'm an essential employee and I've got to work. And I need to feel safe that she's going to keep it on. And she did. She has the same unicorn mask that she got from the beginning. The thing's beat up. It's like needs to be bleached at this rate, but it still works. And we wash it with soap, wring it out, slap it on. She's good to go for 8 hours. So it's soft, it's wicking on the inside, your face doesn't break out. You want to wear it, and we need to teach you how to. People need to know about the tip. You got to cover the lid. You got to get it around the chin. And so the manual has that. The ongoing trainings have that. And then our partnership with ASTI means that we can subsidize the cost. So a one-time worker grade mask is $10. That's it. And your community members, your clients and customers, they need masks too. They need good ones. They need ones they can afford, and they need a one-time purchase. And we also need to be eco-aware. We've got 20 billion pieces of single-use PPE going into the waste stream globally a month. And here in Seattle, we're eco-aware. So in our support package, and if you have questions about that, you can put them in the chat too. I believe the VP from ASTI is on the line, our partners in crime from the beginning. You're going to get that, and you're going to get it logoed if you want. So you have a community of safety and investment. You can make it a fundraiser too, so that you can weather the storm if you're reduced occupancy. So it's a holistic method in order to keep you open and keep everybody safe. And just to round out that conversation, I have one of their newest worker grade masks right here with the SSI logo. This is the one that I chose for my fit, and it's even got an ability to add a filter if you're in a higher risk situation. And it's really that simple. It's good, it's tight, it's breathable. I still have my hairstyle, and they have clips and not. So I stress that because we're only as good as our gear and our protocols. So that's one of the benefits of our relationship. And then we have a resource bank. So as you come on board, starting next week, right off the bat, you get the what to know, what to do, and how to do it, that manual, 40 pages plus a bunch of graphics in the back that you can post. You get the online support, which is an orientation right off the bat, because you're going to get that risk assessment chart and description, but you're going to have questions, and we're going to work it with you. We got an hour with the experts every week where we get in the Cleaning Industry Research Institute from the East Coast, who they've been doing research and recommendations on which cleaning products. Because guess what? It doesn't have to be quartz. It doesn't have to be bleach. It needs to be soap and water on spot cleaning. And then your deep cleaning can be hydrogen peroxide. Your sanitizer, you can get it in 256 gallons so that you can have a reusable bottle, and when to use it and where. So our experts are there and our relationships with them. And then your weekly Q&A, you can just submit questions as you go every day, and we're going to get them answered and get them into our resource bank. And for 6 months, that's what you've got every week standing by. There's also a voluntary certificate program. Maybe you want your staff to go through on a regular basis. Maybe you want to post that you're socially safe and certified, in addition to posting what you're doing at your site. You got the discounts I talked about, but you also get a stack of cards with a code on the back for any one of your customers to go online and watch and engage with the activities and the presentations on a 3-part, 1 hour each course called Disease Transmission and Social Hygiene. And there they're going to learn how to do those same things, but for themselves and their family members. So they walk in their site, your site, they know what to do. And so that's a holistic package, and they can get into the course for $5. I mean, we're a nonprofit. It's just about keeping the lights on and the staff healthy and paid. And so the last part, and this is most critical for getting the whole community below that 50 per 100,000 people mark for disease transmission is with each 6-month support package, we can donate one to a community institution, how big or large they are, so that we can accelerate our path to reopening and to getting everybody safe. Because as we go through this and April 1st comes, and we'll tell you how to look for that online through different resources, as April 1st comes, it gets warmer. Inherently, we have weather on our side because that helps reduce the spread. It goes around the globe, but here it's going to help. But we still have the consequences to deal with. And so we're going to reduce those by getting everyone trained now. And your investment and your customers' investment and our investment, it gets us all there, and it gets us there as fast as possible. So it's $400. That's what we came down to in order to get all of that going, to be realistic and to be front loaded so that you can start right away. And so one of the ways we think about this, independent of fundraising with really good gear, all that aside, is how much does that cost for a customer to invest in your site being a safe spot to participate in, to come back to, and to feel a sense of belonging? Well, if you have 100 sales a month right now, 25 a week, you're at reduced occupancy over 6 months, you're talking about 3/4 a transaction. As you ramp up, you can get closer to dimes and pennies. So we see that is the investment we're all making in each other. Basically, that's how we're going to get there over 6 months, and we're going to adapt. We're going to change as we need to. We're going to keep you up to date, and we're going to be there for you because you're there for us. I need to get my daughter back out to her classes and get out of the house to the coffee shop and buy the things that aren't just those 3 things on Amazon or Instacart. So I'd love to see my local restaurants again. I miss them, and I want to make sure they're doing okay. And if I feel that way, I know everybody else does. I'm getting sick of these 4 walls. So with that, public health education, it just turns our shared spaces into safe places, and our economy is the core of our community and our health, our community health. So thank you, Diane. Thank you, Ashley. Thank you for everyone watching this recording, and especially thank you for the people here today, because I believe we have some time for Q&A.
I just want to say thank you so much for being here today and for sharing this information. It makes me happy knowing there are Lorelei's in the world.
There's a pack of Lorelei's. I see some questions in the chat too.
Yeah, I was just going to say there's a question in the chat.
Let me start from the bottom and work my way up because I can see them. Okay, how much extra is the branding? It's not. They dye subs, so it's kind of like a tattoo into the material. So you just pop your logo on. That's what they do, bulk orders. These sit, I think, at around $10 a pop right now. The branding doesn't matter. At the end of this, if Steve's on, we can punt back to him, but they have all sorts of colors and pretty much everything you want. You can go on their site right now. You can see all their products. But especially you can see just what clients and everybody's been purchasing to this date. And we can come back if there's further questions. Yeah, it is, I think, nothing compared to risk litigation. And one of the things we have lined up for the February talks is we have a partner in legal, and what we can provide is a template to start with that's been used in other industries that work with communicable disease. And it gives you that beginning legal language that you can then take to a local lawyer so that you're not paying 5 or 6 hours worth of review. You're really just paying for the time you need in order to tweak it for your site, industry, as well as for your local regulations. Let's see here. Let me pop back up before I go down. Okay, those are the links. Okay, and so I see the last question. I'm running an event with 500 to 700 people in January 2022. Good, you got a year. Is this program applicable for live events? Yes, yes. It's applicable to anybody that's got a building. It's just like fire code or food code. And mind you, those code books are so big, mainly because a lot of people have screwed up accidentally in the past. So it is applicable. We also have partners with the hand washing stations right now that are rolling out 1,900 in the Auburn School District alone, so that not only do you have the visual of safety, but through that relationship, you can get the whole place stationed in a variety of movable single or multi-unit hand washing stations. And we have ventilation specialists, so they could come in with the property manager for the event site and without any regulation involved, because they're industry, go through and help you tweak that. I'd love to see everybody masked with the right mask for that event. So it's absolutely applicable. And for those larger scale events, we can certainly talk about what that would look like to ensure that what your protocols are and who you're working with is going to work on the site. We might even be able to come out and just walk the site with you, depending on where it is, or virtually. So we're game for anything that keeps people safe. And if anybody has anything that you're experiencing that I haven't covered, feel free to put it in the chat or call it out, because all information is good information.
No, the timing of this is perfect for me because I'm actually the convention that I run is on January 22nd. We're supposed to be announcing our full COVID protocols in the event we are where we are now. So I really cannot thank you enough for being here today. And I was looking for a source for masks that I could present to everybody, and this is great. So and again, I like the fact too that there's science behind the mask as opposed to just somebody pumping out masks, and there you go. So thank you.
Let me speak to that point too. So the bus drivers, the unions masked them because the county didn't have a supply. And so, and everybody was looking at surgical masks because the surgeons were fighting for surgical masks here in Seattle. We were slammed. And the polyester spandex weave, it's like a 21st century soldier's weave. And so we'll have Steve get you out a couple right away, because as soon as you feel them, you're going to know it's going to work. But it is not only science backed, it's behaviorally acceptable. And Steve, for that one too, I don't know if you thought about it for your protocols, but getting your customers or anybody that walks in that door through at least 1 hour of the 3-hour online class for community members might be a really good way to the legal liability, to make sure that the liability is also on the person walking through.
Right.
And I'd love to see that, because then I guarantee one more person isn't going to die, honestly. So we can talk offline about what that looks like to get it out to a whole group of people. But we have the e-manual pretty much in place. And it sounds like even if it's in draft form, we need to get you a copy if you're rolling out those protocols ASAP.
Okay, great. Thank you. I appreciate that. Yeah, we'll definitely be speaking afterwards.
Yeah, thank you. Set up a consult. That's a great question. So what we need everyone to do is get the safety package, because you got to get the e-manual. If you don't get through the e-manual, then we're going to spend a lot of airtime talking through what you're going to learn in the e-manual. So it's something you can plow through pretty fast. But you got to register, you got to get into, it's set up as a course, and then it has different classes, as it were. And the first class will be the e-manual. You got to get through that. And then the orientation becomes a bit of a consult in and of itself. And maybe we need some larger ones for specific organizations, and then the small businesses ones, a lot of it will apply the same. But we have limited capacity. That doesn't mean you're going to get any less support. It does mean we might need to cap our support at some point to the number of people that we can handle as maybe we increased capacity. But to that point, we really can't talk until you go through the what to know, what to do, and how to do it. It also keeps our lights on because we've been volunteer staff the whole way through, and we want to be there every moment. And everything we've put out there to date has not been an income generator. It's stuff that we've all invested in. And I should make and we're going to be here for the long run, don't worry. But I want to make it a point that we don't take government grants, or we haven't sought any out. We don't take anything from any grant funding agency. We are nonpartisan, and we are about science, health promotion, and education. It's what we've been doing for decades collectively. So we don't have to keep our voice and our recommendations within a box, which is why we had people mask before the CDC recommended it. We had a breath cloud image on our website teaching about the fart breath cloud back in July, because we knew aerosols were going on, but the people that set the regulations and that control that discourse, they have their own things, rightfully so, that they're working with. So you just get it straight to the core with us. And I should say, Ashley, if people got what they needed to know here, or maybe they don't know what they want to know or need to know, I can also just go through a couple of quick tips right now so that as you roll this out to your broader audience, they can walk away with like something right now that they can do, because every minute counts. So I'll give it another minute or two, or if we see questions pop up.
Yeah,
Yeah. So I was with the clinics and clinic staff. I was not a King County employee. I was a union labor leader, oddly. And I was the standing coalition co-chair for the King County Coalition of Unions. And my specific members were all 500 King County public health employees that weren't doctors and nurses. The medical assistants staffing all of the quarantine sites, as well as the admin staff. And so as far as partnering with them, I mean, the DOH is definitely partnering with them on a lot of stuff. We have circulated all of our community, the community class. We have that for free with a code that people can get into. I think it's really about what those groups want to know, want to do, and how to do it. And when it comes to working within a government structure, there's a lot of approval processes. So the beautiful thing about a public-private partnership is that the community can embrace it and take it. So we have partnered with them in some capacity, but ours is really focused on business and the economic health. And so where that support is. Now, what will happen in the next 6 months is that's where the 1-for-1 matching is on the 6-month program. And so that's where the community groups that have the capacity and appetite really to take this in. Now, I should mention, non-medical is really important. So if you've got medical procedures going on, if you're at a quarantine center, if it's just like if you go in to have LASIK surgery done, or you go into your dentist, they're going to be geared differently than your coffee staff or your dance studio. And the reason for that is what we all know. You go into one of those situations and you're working with body fluids more than what just comes out of your mouth. So they have a very tight set of protocols, ones that businesses wouldn't be able to meet. And it's really, what we do is really about the broader public health promotion and education. Also, if you have a person test positive, here's a tip: go on WA Notify, Washington Notify, on your phone, iPhone or Android. Go into your settings and you're going to see this new little feature. It looks like a little COVID ball in Washington, and it says notifications on it. And this, I guarantee you, you have privacy, you will not have any of your data shared. It's not collected. But what happens is you voluntarily register. And if anybody tests positive who uses this and they choose to hit the button that says I tested positive, then in the last 72 hours, your phone's going to get a notification and it's going to see if the code associated with that phone was within proximity to yours in a short amount of time, 15 minutes. Now, 15 minutes, it's not all in one chunk. 15 minutes in any length of time. So if I go pick up my kid from her daycare and I'm talking to a parent and that parent tests positive, and maybe it's only 10 minutes, but then I go back and I'm like, oh, hey, let's drive down to the 7-Eleven together and we're not masked or ventilated, then that's 15 minutes. So you're going to get a notification and then you can go ahead. It's all passive reporting. It's your decision. You can put it in your phone that there's a possible exposure. It'll do the same out. And also, to go to get tested, roll down to your testing site, get the swab in your nose, and they're getting really good about sending back results pretty quick. So Wall Notify is one right now you can use. Yes, great question. Is it going to be ongoing? So what our initiative does is we're here in times of unique and extreme circumstances. However, I think it's fair to say that we might be in unique and extenuating circumstances for our foreseeable future. Honestly, is the disease or is the virus rather morphs and is very good at mutating and circling the globe. The virus that goes in, and there's millions of them, it's not just one virus. You have to hit a certain load. The virus that comes in isn't the virus that always comes out. Vaccines, great. Let's get everyone protected and get that spread down. But vaccines, just like the flu, they need to be updated every year. So yes, there will be ongoing membership and it will morph through time. We're going to be there to support you for the long run. We're also looking at really cool programs like the Social Safety Day for kids, where we partner with museums and we have installations and the kids come around in black light and they get to play with soap that is non-toxic and it glows. So they can see, oh man, washing my hands for 10 seconds, like real fast, it ain't that great. So we have a lot of really cool programs we want to roll out later in 2021, and supporting businesses is the core of those. So it'll be adaptable and it will be responsive, but it will be there. And I think as we come out into the renewal membership, we'd love to see a placarding system. And that's a community derived, supported, and implemented placarding system so that when people walk into any institution or building or business and they see that shield, everybody knows what that means and they've been through the training. And so that ongoing membership may be very well that placarding system. And is a part of the program, there is that voluntary certificate ability. And through that, we can also track, give you quarterly reports, how many people in a zip code are getting trained in this. We can give you reports specific to your sites and your customers that are using it, or certifications for onboarded staff. And we'll also make sure that it's aggregate. I have a great publication on making sure that people's data is protected and used appropriately. So we're very big about aggregate data for any data that we do use, and about voluntary and consent participation. Yeah, doesn't it sound cool? And it's community derived. It's not, government's important, but we don't need another code inspector coming in that doesn't have the same processes across the board. We just need the community to say, yeah, good job, you're socially safe. It's kind of like you go into Subway and you see the shield over the food. If you didn't see the shield, you'd probably walk out. I'd walk out. We're rounding out the hour here. Maybe we have just a few more moments for tips and tricks, Ashley. Okay. One of the big risks for transmission is vehicles. So when this whole thing first started, I was down in Florida because I needed I needed family to watch my 6-year-old. It was too much. We had 2 essential employees in the house, and my daughter was just hearing things that really brought her to adulthood way too quick. She posted one of her first videos as a way to like teach and educate and make it positive. It's on the kids corner. It's in March, and the poor little deer's 5 and holding a sword about how we need to fight the virus because her father's immunocompromised. And so we went to Florida, and it hadn't hit its peak yet. So I'm doing this work, I'm doing this training with my family member, and my father and I, he's 76, 77, we go over to the site where his Dulcimer group gets together, and they're considering reopening because their quarantine's over. I mean, IHOP's Grand Slam Mother's Day breakfast reopened indoors. Like they were ready to go, tragically. So we went over, we had our masks, we were outdoors, and I walked through her room and did a risk assessment with the owner. And everyone was so good and diligent. And then she drove my father back. It was only like 5 or 6 streets. And they pulled up, and there they were chatting, talking to each other with the windows up because it's Florida and they got the air conditioning going. They didn't know to use the recirculation in your car. When Jiffy Lube says, do you want to replace your filter? This is the first time you can say yes and use that recirculation button. And there they were without their masks. And they just didn't even think, because it's just that easy to slip into our normal behaviors. And we want to see people's faces. So if you're getting in the car with people that don't live in your household, or anybody, honestly, that might have the flu, our flu rates have gone down. Seasonal flu, they've gone down a lot. Mask up. Crack the windows. If it's raining, crack them just a little bit, the back windows, get the vent system going, recirculate that air, blow it out, and suck the aerosol up and out. So that's one. At your site, the gold standard right now is to replace the air at your site 5 times an hour. So you'll want to talk to your ventilation specialist. WAMOA is a good one. They have a long acronym, but they're basically like ventilation maintenance operators. And so you can get help from them too. And we have a lot more resources in the manual. But the goal there is to do 2 things, is to get the air outside and replaced in, and whatever's not going through that process on an hourly basis, to get it to hit the filter. Now, our systems aren't necessarily rated for MERV 13, which is that gold standard, but something's better than nothing. And a lot of things together get the risk down. So the protocols are used overlapping, which is critical. But what you're going to want to do, and it's going to cost you more change in the pocket or out of your pocket, especially for your property managers, but that's where that investment comes in from your clients and customers, is you don't need to run your heat and you don't need to run your air conditioning, but you need to run your fans. And so get that ventilation system going 2 hours before you open, and 2 hours after the last person leaves, not when janitorial staff starts, after the last person leaves, and get that air moving. Keep it moving through the day. Fix your bathroom fans. Consider putting fans in different places. When you learn those hot zones, you'll know where you want to get stagnant air going, because it's only certain places depending on traffic and some other variables. And occupancy load, which you'll learn, you probably already know because of all the regulations that have been coming out. Ventilation is key. And if your system can't push a MERV 13, MERV 12 and 11 and 10, they're still good. It's a percentage they take out of the air. So don't feel like if you can't do the gold standard in a lot of stuff, you're still doing it right. That soap and water is still your go-to gold star, and it's cheap. Don't use fragrances. They're asthma triggers. Don't use fragrances. They might smell good, but you can get some like orange peels also in the bathroom. And consider using barriers. So there's places where you just got to talk to your clients. You got to wear the mask when you wear the mask, but maybe you have seated area and you're looking to move indoors. You can put up plastic barriers, and it makes people feel like they can see everyone. But also humans kind of like feeling like they have a safe space and you got the air sucking out. So there's a lot of stuff you can do, even if you don't feel like it's perfect. Once you get that list of 8 or 9 things shown to your customers and your staff. Your staff are going to feel so empowered because they're going to feel confident. It's going to be controllable. It's going to be predictable. And that threat is going to really reduce down to the, if you do have a little bit going in and out, it's going to be okay. Your body's strong. Even those of us like me that are immunocompromised, we're strong. We just got to make sure it's low enough that we can beat it and move on. We won't even know. Ashley, I've been taking up a lot of airtime.
Good though. It's all really important information. And like you said, those investing in those things for your employees' benefit as well. I worked for an organization at the beginning that of the pandemic that didn't really take some of the safety protocols seriously. And it, as an employee, it was just a confusing sentiment to have that. And so when someone, you know, does put these things in place and make the practices a habit of their own, because all of us are having to change our habits and how we interact with one another, it gives you confidence in your leadership. So I think the information that, I think all the airtime you've been taking up is really awesome. So no, it's great. I don't know if there's any other questions, but I think there's a lot of agreement in that sentiment that this community awareness is really important and that this is just really awesome and amazing information. So yeah, thank you, Lorelei.
Yeah, and your staff, that's your workforce. That's who we need to protect. Over on the state side, there's been so many childcare workers that just don't feel safe. And maybe that's education, maybe that's implementation, and having the standard consistency, because we always are in work sites where not everyone does the safety standards. It's just a product. Even my family, they're not wearing the mask sometimes, and you'd think they all would be. So having that standard, it really increases worker productivity. It builds a sense of community. And for 3 years, I was all about the workers. So that's at the forefront of everything we have. And it's good to have them come to work and feel like they're in a safe space where they're producing for their community and their families. And that's the only way we're going to get through, is a sense of resilience. And resilience is knowledge, power, and execution on safety. It brings us health. And smile. It just makes it better. It just makes it better when you smile. And we do have people that can't wear masks. My sister was an essential employee in early child intervention, so 0 to 3-year-olds. These kids can't have stuff touching their face. People have phobias. People have had traumatic experiences that involve their face and mouth, and they just can't do it, or they have medical conditions. And so we can still protect them. They're not a threat to us. We can protect them. Our older Americans and residents, anybody that's in the 20%, kindness is key, because kindness is empowering. So if you see someone that can't wear a mask, make sure to smile. You might not want to bend down real close if they drop something, you know, you can let them take care of themselves on that one. But we can definitely support everybody in our community, because we need diversity and we need everyone on board in whatever capacity they have. If you did, I saw a couple of things about gear. ASTI does have those 256-gallon totes of the sanitizer. I wish I brought mine in. I literally have the same sanitizer bottle for the last 3 months. It has a nozzle top. Nozzle tops are critical. It's hard, so I can refill it. You can they have a pouch. You can put it on the side so people can see I'm wearing it. And it's the refillable. They were eco-conscious when they chose the plastic. But those sanitizer bottles are key. And what's really cool, I love this, my older sister loves it, is that it has aloe and vitamin E in it, which is not an asthma trigger. And when you're sanitizing, especially your staff, like 10, 20 times a day, Your hands, like, they get dry and they break out. With this stuff, first of all, you feel it kind of like Elmer's glue for a little bit, like 20 seconds. 20 seconds. It makes you do it for 20 seconds. And then after that, it evaporates. It really feels like magic. This is what my daughter says, and she doesn't do sales pitches. And so it feels like magic. It dissipates and it's gone, and your hands are soft. And so it's, again, a behavioral change that's doable and easy. And you're not wasting tons of the stuff and putting it in the waste stream. And you got a consistent supply that can be shipped all over the country. That's what they do. They do good products, and they do supply and distribution. And they have worked with us the whole way through to make sure that it's going to be darn right the first time. So thank you, Asti.
That's awesome. I actually recently used hand sanitizer that had the moisturizing in it, and it is kind of like Elmer's glue at the beginning, but afterwards your hands really do feel soft instead of that like
Yeah.
dry, weird feeling that you usually get, sanitized feeling you usually get after regular hand sanitizer.
Yeah. And you still get the burst of the alcohol base in it. So, you know, it's like, it's working, and then it dissipates pretty quick.
Oh, that's wonderful. All right. Well, I don't know if anyone has any other questions. If you want to leave them in the chat, or feel free to ask them before we wrap up and end the recording as well. But yeah, if you want to come back to any of this information, we will be posting this on our YouTube channel so that you'll have access to it. Or if you wanted to share this information with anyone as well, you can share that link.
Yeah. And the registration wait list is there. I really recommend getting on it. Do it if you're serious about jumping on board, because it's going to be limited spaces for the next couple of weeks as we get up to max, or as we get the whole way up to where we want to be and do it right. And then, Steve, I'm feeling like you're going to have a lot of site operators, or at least geographical, in the 2022 event that you'll probably want to put through that. Instead of having one person responsible for the whole accordion effect. So in situations like those that are kind of not your standard package, let's go ahead and get your stuff addressed ASAP. Thanks, team.
Awesome. Cool. Again, thank you so much, Lorelei. Thank you for the information today. Thank you for your time and for everything that you and your team have been doing. So thank you for your effort in keeping our community safe.
All right. Have a wonderful day, everyone. And April 1st, we'll get there. Stay diligent.
Bye.
Bye.